If you've recently been diagnosed with arthritis, you may wonder how you got it and what you can do about it. Here to talk about it is Dr. John DiMaggio with Tulsa Spine and Rehab. Dr. DiMaggio, what causes arthritis?
First, I kind of want to talk about what it is. So a lot of people just think it's pain. Essentially, that's definitely one of the symptoms, but it's sort of a breakdown of the cartilage between two bones that articulate, meaning two bones that work against one another or with one another. So, for instance, the knees, elbows, all the joints in the spine, and over time, either through previous trauma or wear and tear or a sedentary lifestyle, you start to get a breakdown of this cartilage, and then it starts to develop inflammation, becomes painful. And so back to your question, what is it? What are the causes? Pretty much the wear and tear, micro trauma, people that do repetitive tasks over time. Runners will see it sometimes. I mean, there's not great research on that, but if they're heavier than their body should be, if you carry excess weight, things like that will predispose you to risk for arthritis.
But joint pain isn't necessarily arthritis, right?
No, I mean, you can have acute pain like ligament damage. You can have strain. You can have tendinitis, tendinosis that will resemble or that will present as joint pain, but they're not truly arthritis. Typically, you're not going to see a lot of people with a true complaint of arthritis that are younger than 30. Usually, after that, you start getting into a more true arthritic type of presentation.
I was going to ask you about that age-related. I think a lot of people hear arthritis and they necessarily think, senior citizen. Is that necessarily true? I mean, can you get arthritis at younger ages?
So, I mean, if you're someone that's been, wrestling, or you've been, someone that rides dirt bikes, you fall off horses, if you've had these repetitive traumas, you're bashing yourself, you're kind of, your joints have been through the ringer a little bit. And that's not to say you can't get it when you're 20. It's just that more often than not, it takes a while to develop. So even people that have multiple motor vehicle accidents where they've had whiplash, they'll start to get some of that breakdown. Things will become restricted. They don't move like they should, and the joints deteriorate and kind of perpetuates from there. So typically, if it was a textbook thing, you'd say somebody that's probably 50 or older has got arthritis, but that's why the history is so important to kind of take from what as how things typically present, and then kind of mash it together with what's unique to this person.
Once arthritis does present, does it necessarily inevitably get progressively worse?
If it's left untreated, or you don't take medication, you don't do anything physically for it, it's only going to get worse in my estimation. But typically there is a management standpoint that patients can take, meaning that you can work on it. It's not necessarily going to get much better, but with injections that they're coming up with now, there's lots of cartilage and joint supplements. Anything to decrease inflammation is going to help. And definitely staying mobile is kind of counterintuitive. People think it's hurting me, why would I want to move more? But that's really how the joints feed themselves. They're not they don't have a great blood supply like organs and skin and other tissues. So feeding themselves is really happening through motion.
So when it comes to treatments, you mentioned injections, there's medication, that sort of thing. How do you decide who needs what? What are some of the indicators that informs the treatment?
So going back to that history and just really kind of understanding what is unique to this patient, how they've been dealing with it, how long they've had the problem, and then where to go from there is going to be sort of most patients respond well with conservative care and strengthening the muscles around the joint that's affected, taking some of the pressure off of that joint by, working with their biomechanics, making sure that the way they're walking, running, whatever their activity level is, kind of making sure they're doing that in a safe manner. And then some of these injections and things like that, maybe if they're not responding to the conservative type care, you'll send them out for either, I know there's some steroid or things that help with the inflammation. And that also depends on the severity of the arthritis they have, the joint, how much, what kind of arthritis. Arthritis is sort of a blanket term, but typically when we're saying arthritis, we're referring to osteoarthritis is the most common kind. There's also inflammatory types like rheumatoid arthritis, there's gout, there's different things that affect the joints. But for the sake of this conversation, we're talking about osteoarthritis. So it really is dependent patient to patient on how you're going to, kind of handle that case.
If you're dealing with pain, contact the team at Tulsa Spine and Rehab to see how they can help. 918-743-3737.